Good evening. I'm Dr. Greenbrier Almond, and thank you for joining us on our program, Tender Loving Care. Each week on Channel 3, I'm happy to talk about this interface between Christianity and medicine. Tonight, I'm pleased once again to have a topic that meets those criteria, this union of Christianity and medicine, and that's a program that's offered right here in West Virginia at West Virginia University. It's the Dean Ornish Cardiac Rehabilitation Program, and it combines exercise, diet, and spirituality and meditation. And it has been shown not only by the Blue Cross since 1997, but now by Medicare in 2011 as being scientific sound enough to be covered as an insurance benefit for people who qualify and need obesity services, cardiac care services, rehabilitation services. And this is a big business decision by not only Blue Cross but also by Medicare. It's estimated something like $400 billion is spent on heart disease alone each year, and $150 billion spent on obesity care every year. And those numbers get very huge if you just add a few more things to that ratio. But Dr. Dean Ornish had been working on this concept that we can restore our health through exercise, through diet, through meditation. He's been working on this for some time. In fact, I heard him years ago, probably before 1997, give a talk in which the doctors in the room gave him a standing ovation. We were so pleased to have a doctor actually coming forward and saying, let's do some integrative services. Let's do some services that don't occur after the horse is out of the barn, after the trouble has happened, after a heart attack or stroke or something horrible has happened and people have lost their health. Let's start at the beginning and do some preventive services. Dr. Ornish has shown, and by the way, he works out of California in a cardiac research institute at Sausalito, California, and he spoke to us in San Francisco a number of years ago, and that's where we gave him a standing ovation. He was showing us hearts as we can take x-rays and do the arteriograms and see the clogged arteries. He showed us arteries that were being dissolved of plaque, and the circulation was returning to normal. We saw people who were grossly obese losing weight, getting back to normal weight. We saw people in my area, in particularly of medicine, who are depressed, getting a 41% reduction in their depression scores without medicine and without psychotherapy, but just if you will, some common sense measures that through discipline work. And so I'm very pleased to talk with you tonight about this concept and know that it's right here at West Virginia University, that Ruby Hospital and the Dean Ornish program is front stage and center right here in West Virginia. Now, in 1997, Dr. Dean Ornish predicted, he said, I want to do this in West Virginia. He says, out in California, everyone is health conscious, we're exercising, we're keeping our weight down, we're interested in health and tanned body and forever young and all that type of thing. He said, but if I can prove that my program works in West Virginia, then I can prove that it works anywhere in America. And of course, as a West Virginian, I thought, well, he's putting us down a little bit, as always. But he was right to pursue his dream. And from 1997 till 2011, he was able to convince Medicare, which is about 50% of all the payment of government services, insurance payments, that his program is sound enough and that it works. So I want to describe a little bit about what the Dean Ornish program's like, and as always, I go to current literature. I'm looking to keep you up to date as someone who watches our program, Tender Loving Care, about this interface. And this is from an article called Government and Medicine, Medicare's New Approach. And this is hot off the press. This is the 21st day of May, 2012, from the American Medical Association's newspaper. And this is it's quite a good article, and so I want to share some of the thoughts with you. Well, first of all, we all know people who have heart disease, don't we? And when I go to the newspaper and look at obituaries, and I see that someone has passed away who was in their 40s or 50s, I'm making some assumption in my own heart that unfortunately here's someone who had heart disease and died suddenly. And some of these are my dear friends, and I find out, of course, that that was what happened to them. And so we found out even in when I was in medical school, starting in 1970, we had the Vietnam War going on. We had young men dying in Vietnam, and the pathologist, those who made it back to a hospital, were still alive and maybe died in the hospital. They were doing autopsies to see what is happening to them, and they were seeing that there were clogged arteries or beginning to be plaque laid down in arteries of people who were 18, 19, and 20 years old based on the American diet and the American activity cycle, and we knew we were in for a long haul with heart disease. And now of course this is a leading cause of death in our country. We also have seen the rise of obesity. If you go back to our local newspaper and look at the old-time pictures that are shown, you get a group of kids who are, say, at a grade school, and it's in the 50s. They look very thin. Uniformly, they look thin. Now go to a current newspaper and look at the kids who are being pictured, maybe also in grade school, and they look uniformly obese to me. And I know that in my own practice, when I have children come in, and I may see 20, and I will congratulate profusely the one normal weight child, but maybe 18, 19 of them are heavy every day, and so we have a problem combining not only with increasing obesity but also increasing heart disease. We have a billions and billions of dollar problem. So this is what Dr. Dean Ornish began to tackle, and as he said, if I can solve the problem in West Virginia, I can solve it anywhere. So let me share with you some of the details here about his program, which is a year-long program. Anyone who's interested, of course, and they live in Buchanan or within the sound of this voice, my voice, can get their doctor to see if they qualify for the Dean Ornish program at WVU, at their Heart Institute, and it's a covered program now under Medicare and also under Blue Cross. So this is an intensive behavioral therapy program, otherwise known as weight loss counseling in a primary care setting. So this is where we live. This is not sending people for revascularization of the heart. This is not sending people for something that's very, very expensive, like a $100,000 operation. This is spending perhaps $5,000, but over a year's period of time, dietitians, exercise, group therapy, meditation, helping people focus and work at getting healthy. Now, there have been a lot of reservations in the healthcare community about this development. Dr. Dean Ornish took his own share of critics. He had to take them on, and he even wrote a best-selling book. And you can go online and Amazon.com or other places and buy a Dean Ornish book about his program, written for the layman. But he had a lot of people who said doctors should not be doing this. We should stick to the medicine, to treat the sick, don't treat the well. We can't change lifestyle, and yet he wanted to persist in this. His pictures convinced me. Pictures worth 1,000 words. When I was in this medical lecture in San Francisco, and I could see that he took an obese person, and I could see the plaque in the artery. I could see it being reversed on the repeated arteriograms. So then I could be convinced if the normal weight is, if the person is losing as much weight, like 22 pounds in a year, as they might lose if they had obesity surgery. And that's just the beginning. You know, they have to be over 30 in a BMI. They have to be willing to stick to that diet, keep going. But over that year's period, if they can lose as much as they could with obesity surgery, then I know we're on to something. And then, of course, if they can prevent their heart disease. So he said, as he said here, we have a great deal of fascination with technology. All of us have been wanting to, a better pill, a better surgical technique, a better whatever technology there is. We want that, and we don't want. We've left behind, for the most part, lifestyle management. Glenn Stream, president of the American Academy of Family Physicians, said while he endorses what Dr. Dean Ornish is doing, he also wanted to caution their family doctors, don't oversell this because it's hard work. And I know a lot of people will try, and they want to get their diabetes under control. They want to get their weight under control. They don't want to have a heart attack. They don't want to be like their father and die when they're in their 50s, or like their grandfather. And they want to reverse that family history of disease of the heart. But do they want to really stick to it? And we don't want to set people up for failure. But it may be worth, and this is what the Medicare folks are saying now, it may be worth $5,000 investment if we can save 30% or 60% of the cost of care later on, which is very, very expensive care in terms of billions of dollars. Christine Ferguson, a professor at George Washington University in Washington, D.C., actually where our granddaughter was born, Harper Rose, at the end of April at George Washington University Hospital. But the hospital where the President of the United States went when he was shot, Reagan went there for surgery. Christine Ferguson, a professor there in public health and director of their Stop Obesity Alliance, said, "We are in the early stages of figuring out how to incorporate the approach without overwhelming the system. We can be cautious, and we're not asking people to do something that we don't want to make them feel guilty. We don't want to set them up for failure. But we do have to have this new approach, and I think to have Blue Cross cover it, to have Medicare cover it. Dr. Dean Ornish is very happy because he said without that type of coverage, people are not going to come forward and even spend their own money. Now, there are certain cardiac risk factors that Dr. Dean Ornish looks for. High blood pressure, which is probably the main factor that we think about in longevity. The cholesterol, elevations of that, including the lousy cholesterol and the healthy cholesterol. Also, the body mass index is too high, maybe over 30. All these are risk factors that Dean Ornish wants his patients to have those risk factors and then reverse them. This is traditionally Medicare has covered about 72 hours of behavioral therapy. So that might be an hour a week over a year and a half or something like that is covered. Not enough really to change the lifestyle. So what's being offered is very intensive, and people are spending a great deal of time for a whole year getting healthy again. But if you can save surgery, or if you can save a life, I think it's worth it. Dr. Shanti Manavani is the doctor in charge of the program at the Ornish program at the West Virginia University Healthcare Ruby Memorial Hospital, a Medicare certified site. And Dr. Manavani says this is something that she coordinates as a primary care doctor, but she's not actually doing all the work, nor can any doctor. She's counting on nutritionists, she's counting on exercise physiologists, she's counting on people who are experts in meditation and group therapy process, all these people coming together as a team and working intensely with people for a year. Remember now, they're going to lose, if they can lose 6.6 pounds in 6 months, that's a pound a month. That's not a lot of weight, but if they can lose that, they can continue in the Medicare program for a whole year, and then hopefully qualify for the big health care benefits that will follow. We're all cheerleaders. I remember one time when I was in medical school, I was trying to understand, of course I saw my father practice medicine, but I was trying to understand what doctors do. And one of the things I hit upon is that we're cheerleaders for our patients. We all advocate for our patients. We want what's best for our patient. we want to encourage them. You can lose 1 more pound. I had a lady today in the office. She had lost 10 pounds since February, and I was so excited about it. And she got excited too, and I want her to continue that, because by the end of the summer I'd like to see her lose 10 more pounds. We're cheerleaders for our patients. And so Dr. Stephen Horowitz of the cardiology department at Stanford Hospital in Connecticut, also a site for the Dean Ornish program, said we're all cheerleaders for our patients. So some of the things that as the article says, that we call the objective measurements, we're going to see the body mass index decrease by 7.8% over a year period of time. So that's a significant loss. The depression scale is going to drop 44%. A lot of people are obese, they have chest pain, they can't get around, they feel depressed. Isn't that marvelous? If you can reduce that, not by giving antidepressants, but by lifestyle management. Diastolic blood pressure will be reduced by 8.5%, significant risk factor for disease. Exercise capacity will increase by 24%, a real increase in exercise capacity. Hemoglobin A1C in diabetics will be down 11%, significant for control of diabetes. And systolic blood pressure will be down 8.7%. Again, a big measurement. Total cholesterol will be down 15%. So all these things are things that can be done through the Dean Ornish program. This is exactly what our program, Tender Loving Care, is all about, that interface between Christianity and medicine. And I'm going to take the Christianity and say it's a spiritual approach, it's a physiological approach, it's combining them at that interface and getting results. And my hat's off to Dr. Dean Ornish and then the doctors at WVU who actually are working this program. Well, the skeptics had to be convinced. 1997, Blue Cross signed on, but Medicare did not sign on until 2011. And they had thought intensive cardiac rehab, weight loss counseling is something that they wanted to see happen. We all want to see it because we know that this is we may risk this generation being the first generation, the young people coming up, who did not live longer than their parents. In other words, if we have so many unhealthy children growing up, then we're going to have many more adults who become unhealthy. And now instead of us living to be 88 and that going on to 90, say, we may start to live like till 85 or something like this. In other words, this generation may not live longer than their parents have lived. So Dr. Ornish's program, as I mentioned, cut the expense of cardiac care for future by 30 to 60%. This is a sizable expense. My mother, who was a healthy person, walked a lot, ate well, so forth, developed nevertheless aortic aneurysm and had aortic aneurysm surgery at WVU. And this was in 1996. Her insurance bill was over $100,000. Fortunately, she had insurance through my father and through Medicare, and it paid for that. But it's scary to think about that. And that $100,000, I'm sure, is a lot more now if the surgery is contemplated. So if there's something where you can spend $1,500 to $3,000 more than you would spend ordinarily, or maybe $5,000 total in a year, and get a lifestyle change, then it's certainly worth it. Now, Dr. Dean Ornish began his program at Sausalito, California. It took him 16 years to get the Medicare on board. He knew that he had to do that, he said, because if he didn't, then it would not impact a significant number of people. And of course, he had to first prove it in West Virginia, because we had such a reputation for people being overweight, having chronic disease, and he did that too up at West Virginia University. Lifestyle changes in his heart program have been a major impact. And now, if you think about this, the other things happening that we think that we tie to obesity include breast cancer. There seems to be a connection, a relationship. And so if we can get people through lifestyle management to work on their heart, work on their weight, work on their exercise tolerance and so forth, we may not only be impacting their heart, which Dr. Dean Ornish proved through his arteriograms, but we may be impacting cancer and other chronic diseases also. That's yet to be proven, but certainly it's a hopeful sign. He wrote in 2009, there was a comment letter written from the American College of Cardiology. Everyone was excited about this program. However, the cardiologists themselves said that they weren't sure that people could keep off the weight, that they would keep up the exercise, that they would keep down their depression score, that they would keep after their program. And they may be right. Cardiologists as doctors are realists, and they know that when people come to them, they want to fix. A doctor, fix me up. And sometimes it's even hard for a patient to stop smoking. We say to them, the cardiologist will say to a person, well, we're going to operate on you after you stop smoking. And it's very hard for people to actually do that, even though they know that that's something that might save their life. So cardiologists were skeptical of this approach, but they have been won over. There was another doctor, Avira Bittner, MD, MSPH from the Alabama Birmingham Preventive Cardiology Department. And she said, why I like the patient-centered approach. She said, I like the bundling of different counseling services. I like the physician leadership. She said, I'm just not sure that this is what Alabama needs, or what people will do. And so the jury's out. I mean, this is a newspaper article. This is announcing a new coverage, but it's also a crowning event for Dr. Dean Ornish and his cardiac rehabilitation program that he's been working on for some 16 years. Physicians also, of course, and this is where a training institution like West Virginia University is important that this is established. Physicians may not be trained well enough to do weight loss, to do counseling, to do diet and exercise programs. And we don't have to do it, but we do need to provide the leadership for it. And I think Dr. Dean Ornish and Dr. Shanti Manavani up at West Virginia University are proving that they can provide the physician leadership in a training institution like West Virginia and train doctors to carry this on. Well, lifestyle modification is something that we've all wanted to do for a long time. I'm so glad that it's happening here in West Virginia. And I wanted to just close with a couple other thoughts because I think sometimes we want to say there's nothing new under the sun, that to God be the glory. And I want to go to a psalm of David, the 29th Psalm, and share with you not necessarily about cardiac rehab, but just about the power that we can ascribe to God. In other words, God has, I think, given us the sun, the air, the water, everything we need. He's given us a way out of our health dilemma if we meditate upon what He has done for us. And so a patient coming through a rehabilitation program for the heart has got to balance their life. They've got to center their life also. So counseling is a part of it. Meditation is a part of it. And so if it's someone who is contemplating how they're going to change their life, how they're going to turn their life over to someone else, to a higher power as they can conceptualize, because a lot of these therapy programs are 12-step approaches based on AA model, NA model, Obesity Anonymous models. These are all 12-step approaches, spiritual approaches. We're going to have to say to God, you have made us. You know us better than we know ourselves. Teach us about ourselves. You have we had a lightning thunderstorm, a windstorm this afternoon in Buchanan. We can see God in the flash of flames. We can see God in the thunder shaking the wilderness. We can see God shaking oaks. We can see God's glory. But for me, as a doctor, the primary glory of God's creation is mankind. We are created a little lower than God. We're created in the image of God. And God does sit enthroned in his in heaven, above the flood, above all else. He's King of Kings forever. He's a strength to his people, and he can bless his people with peace. Now, take a scripture of David like that, the 29th Psalm, and then begin to focus and meditate on that. And you can see the enormity of how we need to change our position. If we think that we're in charge, we think that we are the ones who decide whether we exercise today or not, or whether we eat right or not, that's only part of the answer. The other part of it is we want to remember that we are made in the image of God. We can see ourselves as healthy. We can see ourselves in that image. We have the blessing now, and I'm going to take this as a very specific image just to close with, but bragging too about having grandchildren. You can take a little baby, a precious child, a month-old granddaughter, a 4-month-old granddaughter, and we see that perfect child, and we know there's hardly a blemish on the skin. There's everything is perfect, and we know that body is a gift from God. But we can also thank God for the gift of our own life, the gift that He has given us, and we see ourselves returning to health. Some people image the blood vessel being cleaned out, even as they walk and exercise. They image energy flowing back into them. They see the sun shining down out of the sky after a rainstorm or a rainbow and say, glory. That's the type of meditation that is healthy to do, plus the exercise, plus the diet, plus so many other things. Well, until the next time, this is Dr. Greenbrier Ahlmann thanking you for joining us on our program, Tender Loving Care. Special thanks to Channel 3 for the opportunity to come your way each week. And I am grateful for West Virginia University and the Dean Ornish program in cardiac rehab, and I hope that you will check it out, especially if you have a loved one that it applies to. We'll see you next week.